disorders and substance misuse as a whole. It's a really important topic, especially for anyone who interacts with the healthcare system, which is pretty much everybody, and who interacts with the community at large. This is obviously something that is ongoing and is something that's in the news a lot. So I hope to teach you all something. It's a substance use is an issue that I've worked on a lot. So I'd like to think I have a lot of knowledge on it. So if you have any questions at any point, feel free to interrupt me or put it in the chat. I'll keep my eye on that as well. So the way that we're kind of going to go through this is through a case format to make it a little more relevant. So meet Henry. Henry is a 13-year-old man living with spina bifida. He lives at home with his mom and younger sister. His favorite subject in school is math, and he enjoys to draw cartoons after school. As a result of his spina bifida, he has a neurogenic bladder, which means he has difficulty urinating. After discussion with his urologist, him and his family decided that he should undergo a Mitrofanoff procedure. This surgery creates a small hole in the belly, also known as a stoma, which creates a tunnel from the bladder to the outside world. This permits him to easily empty his bladder with a catheter and prevent the discomfort infections that might happen as a result of the neurogenic bladder. He's nervous to go to the hospital and to take the medications the doctor prescribed for him. So what kind of medications will Henry take? It's common to use meds before and after a surgery like this. And before the surgery, Henry will likely be prescribed these medications. One is NPO, which is just fancy doctorese for saying nothing to eat or drink, because anesthesia can make you a little woozy and maybe throw up. It's not good to have things in your stomach, so it's best to leave it empty before the procedure. Antibiotics. Any surgery carries a risk of infection, so surgeons will take precautions to ensure that the chance of infection is as small as possible. Antibiotics can help your body fight off infection if some bacteria were introduced during the surgery. And finally, IV fluids. Sometimes if you're a little dehydrated, don't have enough water, you can get some saline, salt water, through an IV in the arm. This can prevent you from getting dehydrated while also keeping your stomach empty, since you're not allowed to eat or drink anything. So this is just sort of a diagram of what the Mitrofanoff procedure looks like to give you all some context. So you'll see that you have the catheter coming out to empty the bladder more easily without pain. So the surgery goes great for Henry, and he's prescribed some meds afterward as well. He's in the recovery room. His mom and sister come to support him. He's slowly waking up. So what meds will he get? If at any point anyone wants to pitch in or speak up with their own personal experiences, feel free to do so. I'm just going to walk through some of the medications that you might typically be prescribed after a surgery like this. So to manage pain, you might get Tylenol or acetaminophen, which I'm sure you're all familiar with. It can help reduce pain and fever, but it doesn't reduce inflammation, which is why we'll also typically give ibuprofen or naproxen, also known as Advil or Aleve, which helps reduce not only the pain and fever, but also inflammation. But it can upset your stomach if taken without food, which is why you'll typically either like have a glass of milk or some food before you take it. These medications are safe and can help a lot with pain that accompanies surgery. They're over the counter, so you can just buy them at the pharmacy without a prescription, and they're not addictive, which is why they're typically given without too much concern. You might also get some other meds for pain, such as gabapentin or pregabalin. These are common medications that can help with nerve pain after a surgery like this. And we can also give Toradol, which is similar to ibuprofen, but needs to be injected, which means you feel the pain relief much faster since it gets into your blood faster. These both require a prescription from a doctor. You can't buy them over the counter, but they can help a lot with pain, and a lot of people feel better after using them. You might also get something for nausea after a procedure like this, such as Benadryl, which can help you fall asleep. It's also often used for allergies. I like to joke that you can't have allergies when you're sleeping, which is why Benadryl works really well. You can get this from the supermarket. It's over the counter. You may also get some Zofran or Decadron. Zofran can help with any nausea or vomiting after surgery, and Decadron is a steroid med that can help with nausea as well. These are common medications to get after surgery, but they do require a prescription. The last two, Benadryl's over the counter. Now to sort of the more, sometimes often more concerning drugs are oxycodone, hydrocodone, which are often mixed with acetaminophen, as I mentioned, which is a drug I mentioned earlier, or Tylenol. These are opioid medications, which provide some pain relief. There's also tramadol, which is a partial opioid medication, which means it acts in the similar way that oxycodone or hydrocodone would, but it binds slightly less tightly to the receptor, so it has a weaker effect. And then there's fentanyl, which is an opiate medication that you all may have heard of because it's in the news a lot. It's actually a medication that is given in hospital settings. It can be given IM or intramuscular or IV or through the blood, through the vein, during or right after surgery. Since this can be a pretty potent opioid, it means it's very strong. You won't be prescribed this to go home with. It's only going to be given in the hospital setting. Opioids can be very powerful pain medications, so they can provide a lot of pain relief, but they come with some risks as well. We're going to focus mostly on opioids for the remainder of the presentation, but feel free to ask about any other medications that I mentioned earlier. So how do opioids work? Our body communicates with itself. Our cells communicate through neurons, which are cells of our nervous system. They carry messages between the brain to other body parts to tell them what to do. So for example, the brain will say, hey, arm, reach out and grab that cup of hot chocolate. Your arm will be like, all right, sounds good. I'm now holding it. But when the body feels something wrong, it will also communicate messages back. So for example, if you take that sip and your mouth is like, hey, brain, I took this sip and it burned my tongue. I don't think that's so good. And your brain is like, you're so right. I'm going to let the body know. And that's when you get that feeling of pain. So the way the opioids work is they block those messages. So as a result, your brain won't know that something is hurt or that that something is hurting, so that it won't tell anyone else that you're in pain. In addition to pain relief, opioids can also cause feelings of euphoria, so feeling like you're in a dream, as well as sleepiness. One of the biggest side effects of opioids is constipation, which is why sometimes opioids are also given in the context of diarrhea. So as time goes on, it's been 3 weeks since Henry's surgery. His surgical incisions, they're healing well, and he's starting to use his Mitrofanoff stoma, which is providing him a lot of relief with urination. However, he's still feeling uncomfortable and has been using the opioid medications that he was prescribed, even though the doctor said to only use them for no more than 2 weeks. Typically, 3 weeks after surgery, pain is managed with Tylenol and an NSAID like ibuprofen, Motrin, Advil. So what are some risks of using opioids longer than prescribed? Anyone's free to jump in. Now I'll just move on. So
well, one thing before you get into this important one thing could be because it's constipating. Sometimes people that have like neurogenic bladder might also have neurogenic bowel. And so that constipation could lead to some discomfort or might impact like a bowel management regimen too, because that could throw off the like enema program or the laxative program that people are using. So that could be tricky.
Yeah, absolutely. I think we often think of opioids in the context of how they affect our brain, but not always how they affect our bowels. So that can definitely be a really serious outcome that can cause a lot of discomfort and serious complications. So within the context of this talk, we're going to kind of focus on substance use disorder, which is a medical condition that affects your brain, your thinking, and your behavior. It causes people to have difficulty controlling their use of a drug, like an opioid. Many people who struggle with substance use disorders also experience other mental health conditions alongside that, like depression or anxiety. It's important to know that substance use disorder is a medical condition. It has a clear set of criteria that require diagnosis, which I'm going to go over, but it's important to note that part of this diagnosis is not the quantity of drugs that you're using, nor how long you've been using them. Those aren't part of the diagnosis. Really, the diagnosis of substance use disorder comes from the use of drugs and the extra sort of stuff that comes with it, which I'm about to go over. Which is why, just saying that you're dependent on a drug does not necessarily mean that you have an addiction or a substance use disorder that needs to be treated. So some of the criteria that go into substance use disorder is impaired control over your substance use. So you're trying to cut down, but you can't. You're using more than you wanted to. There's also a social impairment component. So as a result of your inability to control your substance use, you can't keep up with your life's responsibilities. You have difficulty with your personal relationships with friends or family. You can't meet those obligations. There's also risk of use, so like using in situations that are unsafe, such as you use and then you drive a car, or you use alone without telling anybody, something like that. And then feelings of tolerance or withdrawal. So tolerance means it takes more drug in order to feel the same effect. Or withdrawal, which means you stop taking it and you start feeling really sick. So some withdrawal symptoms could be like nausea, getting chills, diarrhea, stuff like that. And it's important to also know that these criteria exist on a scale. There's not one size fits all with most mental health conditions, but with this one as well. So you can have mild substance use disorder by meeting some criteria, but not all of them, versus severe and you're meeting all the criteria. So in terms of Henry's case, as Henry continues to use his opioid medications for longer than recommended, he also begins to experience some social and emotional consequences from the procedure. He's embarrassed to talk about it with some of his friends and family, and becomes socially isolated from some of the people that he cares about. With this feeling of isolation, he would occasionally take more pills than was recommended at once in order to obtain a greater feeling of euphoria alongside pain relief. Over time, Henry develops an increasing tolerance to his opioid medications, so it takes more pills to experience the same, even just pain relief effect. He's tried to cut back repeatedly, but he often experiences unpleasant withdrawal symptoms when he does. When he takes pills, he often further isolates from his friends and family and uses alone in risky situations, such as when no one's at home. So some of the bolded stuff here calls back to the criteria that I just talked about for substance use disorder. So it clearly meets many of the criteria for diagnosis of an opioid use disorder, which just means a substance use disorder to opioids. So what are some risks to Henry's safety associated with this diagnosis and with some of his behaviors? If anyone wants to jump in. Well, I'm sure the one that you all are familiar with is an opioid overdose. So as mentioned earlier, opioids block messages between neurons to prevent pain, but that's not the only message that they can block sometimes, because if you consume too many, your lungs might not receive the message from the brain that they need to breathe, which can prevent a person from getting oxygen in and waste out. And as we all know, we need oxygen to survive. Our cells need oxygen to do the things that they need to do. So with this is a very dangerous situation if you're not able to breathe. And some signs of an overdose that I think are important to know, because you never know when you might be confronted with an opioid overdose of someone you care about. You might see blue lips or nails because oxygen isn't getting where it needs to go. You might feel you're likely not responding. So if someone is rubbing your chest and they're screaming your name and you're not responding, you might be making like choking or gurgling sounds, and you may not notice any breathing. Those are some of the main signs of an opioid overdose. So Henry One day takes too much of his prescribed opioids and experiences an overdose. His mom checks in on him at dinner time and finds him on the ground, making gurgling sounds, not responding, and turning blue. Thankfully, his mom had been at a community event a week prior where she learned about these signs of an overdose, as you all just did, and was given naloxone, also known as Narcan. She administered it and immediately called 911 to get the paramedics to come. A few moments later, Henry regains consciousness and seems to be doing okay. The paramedics take him to the hospital to be monitored. The reason that the paramedics do this is because oftentimes it's possible to go back into overdosing even after the naloxone is administered. So that's why the paramedics want to keep an eye on it to make sure that that doesn't happen. So what is naloxone or Narcan? It's a medicine that quickly reverses opioid overdoses by attaching to the opioid receptors, so the same receptors that the opioids are bound to. It knocks them off of those receptors so that you can start breathing again and your neurons can begin communicating once again. Narcan typically is sprayed in the nose and takes effect almost immediately. It's a very easy tool to use. You literally just stick it up a nostril and push, and it can bring somebody back. And because it will knock off those opioid receptors, the opioids off their opioid receptors. Sometimes you'll also see naloxone in syringes that you can administer, but typically nowadays you'll basically find these at the pharmacy. So where can you get Narcan? Because maybe you may be confronted with a situation in which someone you care about, or even just someone you don't know, is experiencing an opioid overdose. The Surgeon General of the United States recommends that Narcan is carried by as many people as possible. So it's always good to have on you or in your house. And where can it be obtained? In Colorado, there's a standing order for naloxone, which means that you can go to a pharmacy, any pharmacy, and get it without a prescription. And it should be covered by most insurances. But in the event that that is not something that's financially feasible, there are also places that you can get it for free. There's often community events that happen all over the place that you can keep your eye on. The city of Denver, if you live in Denver city limits, has a mail order program. So you can order, I have the QR code here if anyone is interested. There's a bit of a backlog, but you should get it in the mail within 2 to 3 weeks. And they'll ship it to your house for free. They can also ship fentanyl test strips, which is just a tool to test drug for fentanyl. And then stoptheclockcolorado.org is a great resource that shows you a map of where you can get naloxone in the state of Colorado if you're outside of Denver city limits. So, as I said, Narcan is a great tool to have to potentially save somebody's life. I personally saved somebody's life with it. It's a great tool. So back to the case. Henry was taken to the hospital after recovering from his overdose. A doctor talks to Henry about his opioid use and discusses paths forward. After sharing information, Henry and his mom decide to start a treatment program for opioid use disorder. He's given Suboxone, which is a medication used to treat opioid use disorder, and is scheduled for regular mental health, therapy, and social support programs. After some time, Henry's cravings diminish. He begins rebuilding many of his relationships that he had abandoned, and he starts leading a happier life. So just for some context about what Suboxone is a drug used to treat opioid use disorder. It is also an opioid, but it's a partial opioid, which means it doesn't bind as tightly. It means it does bind tightly, but it's less powerful. So you won't experience many of the same effects, but you will, since it will block that opioid receptor, you won't experience the same sort of cravings and stuff like that. And it also comes with naloxone built in, so you won't overdose on it. So now to just go into some myth busting, because I think there's often a lot of myths going around about substance use, substance disorders, substance misuse. So the question, should I be scared to take any pain medications after procedures that I have? This is something that I hear a lot, where people will, go through really painful times of their life without taking opioids that could relieve that pain because they're worried about addiction. And while the potential to develop opioid use disorder is definitely something that we should all be aware of when taking any potentially addictive medications, because this case clearly showed, it is definitely a risk. But there is a reason that we still continue to prescribe these opioids. They're evidence-based, and mismanagement of pain, even by not taking it when you need to, can increase the risks of more dangerous strategies to alleviate that pain down the road. If you potentially don't take it the way you need to, and you experience a really bad pain episode, that increases the risk that you'll take more than you need to at once, or even more dangerously, you'll turn to more dangerous alternatives to manage that pain. That's why it's super important to have regular conversations with your doctors about pain management, about tapering off appropriately so that you're not cutting off opioids too suddenly, because that can also increase the risk that you'll take more at once later. But it's also important to know what the data is now. And the American Medical Association estimates that only about 3 to 19% of people who take prescription pain medications develop an addiction to them. Now, that's not an insignificant number, but it is important to know that the vast majority of people who take these medications don't develop an addiction. And it's important to also know that of these that do, they often have other conditions that predispose them to developing an addiction, such as genetic predisposition or other like mental health conditions that I mentioned often go alongside substance use disorder. Another myth may be that there's no effective treatment for substance use disorder, but there's many. Substance use disorder is a very treatable condition. There are a variety of different medications and behavioral therapies and programs that have been shown to be effective in treatment and allow people to live happy and healthy lives. I think there's often a lot of really negative portrayals of people who live with substance use disorders, but it's important to know that treatment is possible, and many people live in recovery and live happy and healthy lives. So yeah, that is my presentation. I hope that it was informative. I'd be happy to answer any questions that we have. I see that there were things in the chat that I ignored, but I will try to go through them now.
Well, I can maybe pose one of them because we were able to answer a lot of them. Thank you, Dennis. What a wonderful job on this presentation. I learned a lot, and I hope everyone else did as well. One of the specific questions that came up, and I might need a little clarification on this, but are there any things that people that are living with spina bifida should be considering in addition as they're thinking about maybe risk around developing a substance use disorder, or is there different like criteria that people would use if you're thinking about someone that maybe is living with like some additional health complications or medical concerns?
Yeah, so anyone, I'll say what I know, and maybe Alan can jump in a little bit here too about pain management in general. But when it comes to the development of substance use disorder, this is always something when you're taking any potentially addictive drugs that you should be talking with your doctor about, making sure that they don't interact with any other drugs you're taking, because there is a risk of opioids interacting with other drugs you may be taking. So that's definitely a conversation you should have with your doctor. And typically people who live with chronic pain or with chronic medical conditions can be at an increased risk of developing a substance use disorder to manage pain, which is always something to be aware of, which is why it's important to take these medications seriously. But as I mentioned earlier, this is always something that you should have conversations about with your doctor, and you shouldn't be scared to take a drug if your doctor is telling you that it's okay. But maybe Alan, you want to jump in with anything else?
Yeah, I mean, I think that was a great answer. The only thing I really wanted to add too is I think that I think that the regular doctor visits that a lot of people with spina bifida have, and like the regular interaction with the healthcare system, the process becomes a lot more natural. There's a lot more communication between patients and their doctors. And I think that's a really good thing. I think that creates a really healthy relationship. And, if there are ever problems that would arise, I think that, people who have, stronger relationships with their doctors and the healthcare system overall have a lot of resources they can use to make sure that they, are doing the right thing and staying on the right path and staying safe and healthy.
Yeah, we see Dr. Higuchi. You give us a little additional insight, please.
Yeah, thank you, Dennis. I mean, I think that this is a very important